All DSOs are not the same. In our organization, I feel like the right people are making the right decisions for the right reasons, which is patient care. When you have that, you love coming to work every day.
For the clinician, I think being part of a DSO really allows them to do what they love, which is deliver excellent patient care. And they can really just focus on their personal development and growth and be the best clinician that they can be.
We are a DSO, but when you walk into one of our practices, it feels like a regular at-home dental practice. And I think part of that is the clinical autonomy that we give our doctors and our hygienists.
So I joined Mortensen Dental Partners in 2014. At that time, we had about 80 practices. We were operating in about 6 states. Today, we have over 140 practices and we're in 9 states. We have an excellent support system that is really built for future growth. We realize that doctors practicing in solo practice today, the administrative complexities and burdens of running a practice is just continue to increase. And we can reduce those burdens and allow doctors to continue to focus on patients and really do what they love to do.
So in our case, if a dentist joins us, they know that they can come into their practice every day, have a great team, and practice dentistry. And all of the other things that are associated with running or administrating a business, they have a team of people behind them to take care of that.
The main encouragement I had to join the DSO was really 1, clinical autonomy, and then 2, growth opportunities. And growth opportunities not just as a clinician, but also as a leader.
It was time for us to grow, but we didn't have the space to grow. It was difficult to do on our own, but we did it. Years later, we joined Mortensen, and it was time for us to grow again. And it was done seamlessly with them because we had all of the support that we didn't have before with ourselves.
What really drew me to Mortensen and ultimately why I joined was they were what I was trying to grow to be, but they were 10 to 15 years ahead of me. And with some of the other partners in our region, we came together and we noticed that Mortensen's presence in its community, its fondness, and how they take care of their team members really set them apart and really aligned with our values that we had previously. And so it just seemed like a perfect match.
Since 2004, I've been able to see the growth within the organization, specifically with our culture. We've always had a tremendous culture here in the Mortensen Dental region. But as we've acquired and merged with other regions in other parts of the country, I feel that we've also taken the best of their cultures, combined them, and have an even better culture than we had from the beginning.
Mortensen is an employee-owned company, and I feel like that's why it stands out compared to other DSOs.
We want our doctors to treat patients the way they would treat family. We don't prescribe clinical care. We don't prescribe goals and quotas and targets to hit. The care that they provide to their patients is the care that those patients need based upon their interpretation.
It's simple, clinical autonomy. In a nutshell, we'll stay out of the operatory, and how you treat the patient is your clinical decision, and we have very little to no impact on those decisions.
Look around and compare, and you will see a difference between Mortensen and other DSOs. We have mentorship. We have a program called Hire to Retire, which takes care of our providers regardless of where they're at in their career. And we're really focused on developing providers to expand their clinical skills, which ultimately makes them better clinicians and enhances the patient care.
We have a group of people that you can reach out to, but you have the autonomy to treat the person that's sitting in your chair the way that you feel like you should. And really, when you become a dentist, that's what you deserve.
If you're considering joining a DSO, I fully encourage you to weigh the options, compare your choices, and really understand the goals and mission of the organization and where that DSO wants to be in the next 5 or 10 years.
Think about how much of your time you dedicate to running your business as opposed to actually being chairside and treating patients.
There's obvious benefits to joining a DSO. The business side benefits with stronger payer reimbursements, lower lab and dental supplies, some of those business aspects. But I would really encourage them to do their homework on the culture, the mission, and the values. A lot of those doctors and practice owners, they have spent their life's work building their practice, and they don't want to just turn it over to anyone or make that a business transaction. It really has to be a partnership that is built on trust and confidence, and that is what will make it successful over time.
If you just want to sell your practice and ride into the sunset, then we can make that happen. If you're wanting to sell your practice and then you would like to stay with us and continue working and practicing dentistry, then we can make that happen as well. We can provide the support that you need. You can practice dentistry and not worry about the day-to-day obligations.
Look at the culture, look at the clinical autonomy, and look at the development opportunities. I think when you look at those three things in Mortensen Dental Partners, it should be a pretty easy decision that that's a good place to be.